Welcome back to Body Beautiful. I'm Janelle Marie. With us today, we have plastic surgeon Dr. Joseph Mealy. We're talking about a couple different procedures today. We just talked about mommy makeover. Remember, though, any advice we give you today, consult your own physician. All right, we talked about mommy makeovers. Now we've got to talk about breast augmentation and breast lift. You call this the combo lifts.
It's
Sounds like a workout, but it's a combo lift.
It's a workout for me.
That's
patient
true.
gets to rest. But it's a combination that's very important because breast augmentation alone just adds volume. It doesn't do a lot to change the shape. Unless the shape is due solely to loss of volume, sometimes a lift needs to be done. And it's as high as 40% of the cases when we're doing breast rejuvenation that we're doing a lift with it. Sometimes it's a small lift just around the areola. Sometimes there's a vertical scar associated with that. Sometimes it's the whole anchor lift. It depends on how much sagging there is, how much we're trying to fix.
Okay. And what is the downtime on a breast lift aug?
Same as an aug.
Oh, okay.
Breast lifts tend not to bug people too much.
Yeah.
Even though we see more scar with them, there's less pain. The augmentation, it's really stretching, especially when we're under the muscle. That to bug people for a couple days.
Yeah.
But usually by 3-4 days, they're able to drive again. By the end of the week, feeling normal.
And then how do you know if you need your lift or you need your aug? And I mean, is it seriously is just because of the amount of sagging, or is it?
I mean, it's good to see a professional. I can guide you in that. But a simple test is if you put your hand behind the breast in the fold. By the way,
because we can all do those at home.
I like simple things. I'm a simple person. So if I put my hand behind someone's breast and my fingertips are higher than their nipple, they need a lift. It's just
or if you can put like a stapler underneath and it sticks.
If you could hold up a stapler, maybe. But it's a combination of the breast sagging, so the breast tissue itself sagging, and also the nipple position. Because there are some people that have what's called pseudotosis. It means fake sagging, where the nipple's in the right place, but the breast tissue is kind of bottomed out under it. And sometimes in those cases, an implant alone will take care of it.
Oh, okay. All right, so let's talk about breast implants. We got some pictures too in just a minute. Well, let's go to our first picture because I want to talk about implants too as well. What are you using right now implant-wise, and what's popular, and that kind of thing?
Most commonly used implant is a smooth, round, silicone-filled gel implant.
We like the silicone.
With high cohesivity.
Silicone more than the
saline?
Yeah, thank you.
Yeah, it depends on the person.
Okay.
Silicone is allowed if you're over 22 for cosmetic purposes or for reconstructive reasons at any age. So this is someone who had a lift, not only to raise the nipple, but also to pull the right one out a little bit. The right one was inside more than the left one.
Oh, okay.
So we can fix them laterally also. And the volume is just enough so she can fill out the upper pole of her breast.
Okay, so that was, did you have an augmentation on that last one?
Yeah,
so
all
that
these
was
have both an implant with a lift.
Gotcha.
So, and in this case, I think this is a vertical lift, just because I'm judging just because of the amount of movement we have with the nipple. So there's a scar that runs along the front of the breast from the nipple down to the crease.
Nipple down to the crease, is that a T-scar? Does it go into the crease as well, or just from the nipple down?
Not always. It depends on how much extra skin there is. When there's not a lot, sometimes it's just like a lollipop scar works. And usually that vertical scar comes from closing where the nipple used to be.
Okay, and do those scars fade?
They do.
Obviously with time, but I mean, so there's not really they don't stay red.
Initially, they're put together with sutures that are dissolvable.
Okay.
It takes about a year for a scar to be completely mature, though some people still improve after that.
Yeah.
And there's certainly scar care.
Yes.
We do maintenance as it's healing.
Picture number 3.
Same thing here. I believe this was just a perirelar lift because we're not having to move it as far. With a little bit bigger implant, which sometimes also decreases the amount of lifting we need to do.
I mean, there's big time.
But a big implant is not the same as a lift. I could not just put a giant implant in there and get her that shape.
Because the skin would still sag.
Yeah, and the nipple would still be low. And in cases where people have breast tissue, the breast tissue would kind of hang off the implant.
Oh, that's not
pretty.
good.
Yeah,
that is not pretty at all. And I like the fullness up at the top. Now, can you also, if they don't, our last picture here, but if they don't need an augmentation, can you put body fat in there and get the same result if you don't need
You can, it's just a little different. Body fat can't give us the same volume. The advantages of body fat are we can put it where we want it. So if someone has a dent, we can fill a dent.
So you can fill
like
little
after a lumpectomy or surgery. But I think just for generally enhancing the breast,
not as good as an implant.
Implants are still probably our best choice in most cases.
All right, and that last picture you did aug too.
Aug lift, yeah.
Aug lift
so again, perirelar lift with a breast implant.
Now, you were talking about round implants versus shaped implants.
Yes.
Give us an idea of what's the difference.
Under the muscle, they look about the same.
Okay.
So shaped implants tend to work better if someone has very, very tight skin or after mastectomy when the skin's tight. Sometimes it's tighter at the bottom than the top.
Okay.
It gives us a way to push out that lower pole a little bit more. If someone has all their breast tissue at the bottom, not as big
Gotcha.
an advantage. And there are some downsides to it. One is which they have to be textured.
Okay.
And the other is sometimes they'll rotate.
Oh, okay.
And when they rotate, they're not the right shape.
All right, sounds good. For more information about Dr. Mealy, call the office at 925-943-6353. Check them out on the web, either drmealy.com or sanfranciscobreast.com. Remember, you can see all the before and after pictures there on the websites. More to come. Stay with us right here on Body Beautiful.